provides technological advantage to this delivery system for dental injections, resulting in a safer, accurate, and more comfortable dental injection for the patient. C-clad systems can be used to perform all the current dental injection techniques currently taught and may also allow practitioners to more effectively perform some of the newer dental injection techniques developed with C-clad systems, like the AMSA, PASA, and STA intraligamentary injection. The following animation shows the general setup and operation of a C-clad system. There are currently several different systems available. We anticipate that more C-clad systems will be available, as these systems represent a category of new delivery instruments with an innovative approach to the delivery of local anesthetic solutions.
Block, infiltration, palatal, PDL, and intraosseous. These injection technique selections on the CCS are intended only to be a convenient guide to selecting an injection rate. Your clinical judgment should always prevail in selecting the appropriate rate for each injection. To select a rate, just press the appropriate button. The indicator light will show which injection mode you have selected. When in operation, the digital readouts will display the rate, volume, and elapsed time of the injection you are administering. Now let's review the handpiece controls. The front button with the arrow and square controls the start and stop functions by starting or stopping the plunger. The middle button activates the aspiration function by slightly retracting the plunger. The rear button initiates double rate. Pressing the double rate button will double the current injection rate at any time after the first 10 seconds. 2 beeps will sound to indicate the double rate. To return to the normal programmed rate, simply press the double rate button again. Please note that there is a double rate button also located on the control panel. This operates in the same manner as the double rate button in the handpiece. Now that we have introduced you to the CCS controls, let's walk through the basic operations common to every injection technique. Begin by ensuring that the base unit has been turned on. If not, press the rocker switch to the on position. Load an anesthetic cartridge, metal tip end first, into a cartridge sheath. Insert the loaded plastic cartridge sheath onto the handpiece. Press firmly and twist clockwise 1/8 turn to lock in place. Be sure to fully engage the cartridge sheath in the handpiece. The clear cartridge sheath allows you full visibility of the cartridge throughout an injection. Press the load button once to advance the plunger and embed the harpoon into the rubber plunger of the anesthetic cartridge. Select an appropriate standard disposable needle for the injection. Remove the rear cap and screw it onto the cartridge sheath, just as you would attach it to a standard dental syringe. Leave the front needle capped until you are ready to administer the injection. Before the injection, Midwest recommends that you cover the handpiece with a disposable sleeve, as is typically used to cover dental low-speed motors and air-water syringes. Pulling it down past the cartridge sheath so it covers the handpiece but does not obscure the anesthetic cartridge. Select the appropriate injection type. Remove needle cap. If your CCS is located on a counter, use the recap station located on the handpiece holder. If wall-mounted, use your standard recap station. Press the start button. Once you see liquid drops at the needle tip, press the stop button on the handpiece. The needle has been cleared of air. You do not need to alter your chosen standard techniques for positioning or preparation of the site when using the CCS. As with your traditional syringe, position the needle at the site and slowly insert. If the chosen injection requires aspiration, press the aspirate button. The plunger will retract a short distance. Again, the CCS's clear plastic holder gives you full visibility of the cartridge. After negative aspiration is achieved, press start to initiate the injection. You can see the slow rate at which the anesthetic is delivered. This rate lasts 10 seconds for patient comfort. Then the injection rate automatically increases to the pre-programmed or regular phase for the injection type selected. You may stop the injection at any time by simply pressing stop. If you want to increase the rate of the injection, you can do so at any time after the first 10 seconds of the injection. By pressing the double rate button, the increased rate will be identified by 2 audible beeps. Press the double rate button again to revert to the normal rate. At any time during the injection, you can reference the rate, volume, and elapsed time for that injection. Press stop when you've completed the injection and remove the needle from the patient. Recap the needle using the recapping station, remove the plastic sleeve, press unload, and wait for the indicator light to turn off. Remove the cartridge sheath with the needle attached, turning counterclockwise. Dispose of in any approved sharps container. Return the handpiece to the unit holder and turn the CCS unit off. Use a wipe saturated with disinfectant to gently wipe